I'm Eve Lyon, Recovery Navigator for CareerSource Research Coast. St. Lucie Recovery Works is an initiative supported by the Florida Department of Economic Opportunity. In an effort to connect the social service and treatment service providers and the judicial and law enforcement systems to the workforce development community, I invite guests each month for conversations on prevention and responses based on data as it relates to the current local opioid situation. Our ultimate goal is to improve outcomes for people with substance use disorder. Tonight, I am pleased to welcome Dallas Spruill of the Florida Department of Health OD2A project. Welcome, Dallas. We know that addiction is a disease, not a character flaw, and that recovery is possible. The good news is that 3 out of 4 people who experience addiction will eventually recover. I know that your work focuses on gathering data to inform responses that support proactive initiatives. The Florida Department of Health's FDOH work to combat the overdose crisis aims to protect, promote, and improve the health of all people in Florida through integrated state, county, and community efforts. Overdose prevention aligns with the Florida's Health Improvement Plan, which is SHIP, or SHIP, with a priority area of mental well-being and substance use prevention, including opioid use. There is no question that we're in a local crisis, as I am certain that you will reveal through some startling local statistics. Can you talk about the OD2A project, including what the acronym means?
The acronym OD2A stands for Overdose Data to Action. The government-funded program focuses on gathering data about what is happening in the area of overdoses in order to inform prevention and response efforts. This data also helps determine the activities of our community partners at state and local level as a team. This will help to ensure that our efforts will impact the issues of opioid misuse and opioid use disorder while reducing overdoses and fatalities. We, meaning all of this group, want to drastically reduce the amount of overdoses and fatalities and reduce the amount of babies being born with NAS, or neonatal abstinence syndrome, which is the little one being born substance addicted. A similar term to this is SEN, or substance exposed newborn.
Tell me more about what you're doing with other agency partners to address opioid use.
I'm part of the Treasure Coast Opioid Task Force. There are well over 100 members along our Treasure Coast area, ranging from Indian River down to Martin and west to Okeechobee, that represent a variety of organizations. The vision is to ensure that individuals and families that are affected by the disease of opioid or substance use disorder will have complete access to various treatment and recovery services with the same coverage equal to that of other diseases. This means that we want to get people that are experiencing struggles with substance misuse the real help that they need. A similar comparison is that of someone who is diabetic getting the help that they need through the right doctor and appropriate medication and supplies while still receiving education and training about their medical condition.
So important. What are some of the other data that you're tracking and reporting?
We track hospital emergency department visits that involve overdoses, sometimes referred to as chemical poisoning, due to consuming opioids and other variants. We also track and evaluate information related to law enforcement and emergency medical services in our communities. Additionally, we do communicate with the medical examiner's office regarding fatalities and overdoses.
Can you talk about what you're seeing in that data?
Sure. Tragically, we lose about an average of 12 individuals per month due to overdoses here in St. Lucie County. We all want that number to drastically decrease, which is why we do what we do here at our program and at the department, and also the Department of Health, as well as efforts in our hospital staff, treatment centers, law enforcement, emergency medical services, and other agencies here in our county, as well as the Treasure Coast.
So important, and that's why we're talking about it this evening. Are there any trends that you are seeing in our area?
There's a very potent and readily available opioid known as fentanyl, and it's showing up in the street drug supplies. The substance is many times more potent than morphine or heroin and is now being mixed into everything from cannabis to Adderall to OxyContin to Xanax to heroin and cocaine, just to mention a few. The powder product, or fake pills, on the street now actually looks better and more authentic than the ones being supplied by the major pharmaceutical manufacturers. The truth is here, there is now no safe street drugs. According to the Centers for Disease Control and the Drug Enforcement Agency, 4 out of 10 overdoses result in death. There's nothing pretty about this. Every time someone purchases anything from this street, there is a big chance that a fatal overdose is the result. It only takes an amount equivalent to several grains of table salt to cause death, and this ingredient is being found in nearly everything available on the streets, even from dealers who are actually referred to as established. Buying and consuming street drugs is a huge gamble that has a likelihood of resulting in a tragic outcome of game over. This is not isolated to our county or our state. It's a national as well as international crisis that has many of us scrambling to address it.
We want to say that again. There are no safe street drugs. How can data inform and influence local planning on prevention programs?
As we gather and consider data, we can look at trends and also areas of high activity. This can aid other agencies such as law enforcement and emergency medical services to focus their resources on those specific areas of high activity and concern and more quickly and effectively prevent and reduce poor outcomes, which makes our communities safer and healthier.
Are there any campaigns locally that might be noticed in the community?
The Overdose Data to Action program in the St. Lucie County has installed dozens of posters and gas pump toppers at strategic locations to bring awareness to the opioid crisis and also promote programs and other efforts that target substance misuse, which includes opioids. Other groups and organizations that are part of the Treasure Coast Opioid Task Force are also using bus wraps, billboards, and social media messaging warning of the dangers of opioids and the availability of help. The St. Lucie County Overdose Data to Action program also has a website dedicated to this work, which is called findhopeinrecovery.com.
Are there other interventions that we can bring attention to?
Well, there are many interventions in our communities, but the challenge is connecting the individual struggling with substance use disorder with the needed resources or programs, treatment facility, medications, and supports. Remember, the first concern is saving that person's life, but the next immediate objective is to have that person agree to treatment. Finally, we need to keep them involved and dedicated to the treatment program, as well as keeping them connected to the supports and healthy relationships. Recovery is an ongoing commitment for all involved, and it has many moving parts.
Well, we'll be talking about that next with my next guest. How did you get involved in this work?
I've always had a desire to help other people, but quite a few years ago, I began to work in the world of residential treatment, as well as with at-risk youth and adolescent probation. I found the work to be frustrating, depressing, challenging, and sometimes rewarding. But what I saw was young people and their families struggling to navigate this thing that we call life. They were battling generational patterns and toiling against stigma and social system that made finding help so overwhelming and discouraging. The resources that were available for help were minimal, and the staffing was modest and often involved staff members that were struggling with the same exact situations. This frustrated me, but it also provided a spark of ambition to want to make a positive impact on these young people as well as their families. After working several positions and levels of direct care and administrative roles, I was approached by the county government to work in their Protective Intake and Crisis Unit, which worked very closely with the 911 staff as well as law enforcement and emergency medical services. It was during this time that I was able to see the graphic and explicit effects of opioids and other substances at an up-close and personal level.
Was there an impactful story that you witnessed that continued to drive the work and initiatives that you do support?
While working up north in that mobile crisis unit, I was regularly called to crisis scenes in situations where substances, violence, and fatalities are present. A very impactful situation that involved a call from local law enforcement regarding domestic violence and substance involvement, in addition to a minor being present on the scene. First responders weren't sure if the call was a result of substance use, but required immediate attention due to the occurrence of domestic violence. After arriving on the scene and checking with law enforcement, I immediately entered the home while attempting to quickly assess the two individuals that I immediately observed. These two adult household members remained in a verbal dispute that left the room a disaster. I observed things such as broken dishes, spilled drinks, and knocked over furniture. On the opposite side of the large room, I focused my attention on a person that I would described as a young teenage male that appeared unaffected in his sleep while playing a video game with the controller still in hand. My immediate thought was that this young person is accustomed to activities such as this, meaning aggression and violence. I asked law enforcement to keep an eye on the situation with the two adults while I made my way through the room to check on the teen. As I approached the young man, I noticed he was slouched, which is not unusual, in a comfortable high-back desk chair while a video game had timed out. I spoke to him in a very clear and easy-to-hear "hello." I didn't notice any response, so I repeated myself several times before nudging him on his right arm, to which there was no reaction. Hoping for and expecting a reaction, I nudged again, again, but nothing. At this time, I realized that this was more than a situation of nodding off after a long day of video gaming and junk food binging. I immediately checked for a pulse and realized that there was none and that his neck was slightly cool to the touch. I emphatically called for EMS as I quickly and carefully moved the young man to the floor. CPR and naloxone were quickly administered, but frantic attempts remained unsuccessful. This tragedy was impactful to me.
I can't even imagine, and I'm sorry that you experienced that. I know that because it stays with you, you work so hard in our community to battle the demons that people face every day. Glad you're here to talk about it and let the community know how real it really is.
The real crisis is whether you want to admit it or not. It's in our own backyard. If we're honest, we can all recollect names and faces of individuals and families that have struggled tragically or lost someone due to an overdose. We need to be open-minded, supportive, and responsive by doing things such as saying no to stigma, say no to judgment, be humble, be sincere, and care enough about yourself and the others around you to get help for yourself, someone you know, or the families and others that are being affected. I look at it this way. I would rather have a somewhat uncomfortable conversation with someone who needs help now, rather than attending an uncomfortable funeral for them later. Consider carrying Narcan or naloxone. This is an antidote that can reverse an opioid overdose and save a life. This life-saving medication is available in many locations and is often free of charge. If you don't know about help, support, or resources, call 211 and just ask. Please know that there's been increased awareness, education, and emphasis on changing some approaches in our legal and judicial systems. These systems are now using programs to get people help in order to lessen or avoid legal issues. Our local law enforcement agencies want individuals and their families to get the help that they need in order to stop prescription medication misuse, illegal drug use, overdoses, fatalities, and legal issues. Our local law enforcement is working hard towards adding staff that work with drug-involved individuals and families in order to get them connected to the help and the treatment that they need. The main focus is not necessarily legal action, but to help while there's still time. This is a great example of progress right here in our own backyard.
Dallas, thank you so much. I know some of those stories were hard for you to talk about. You did mention 211 as a resource, and I like to always bring that to the community's attention. You can dial 211 on any telephone, and it will bring you to our local Treasure Coast community resources that are available. They don't provide the resources, but they will connect you to the resources, or you can go to a computer, enter 211treasurecoast.org. Again, either 211 on the phone or on your computer, 211treasurecoast.org, and somebody could live chat with you from that resource. Our next guest is Stephany Mathews to speak about local resources and how to access them. Stephany, you're a recovery coach professional and the National Strategic Alliance Manager at Behavioral Health Centers. What does the RCP designation encompass, and what is your role as a National Strategic Alliance Manager?
Well, thank you, Eve. I'm really happy to be with you today. I appreciate the opportunity to speak to your listeners about peer support, treatment, and recovery. My role as a strategic alliance manager, it's just a fancy word for a business development person. So my role at the treatment center is to build relationships with outside programs so that I have resources to send folks that need recovery that don't necessarily fit into my program. As a recovery coach professional, it allows me to help folks that are new in recovery and maybe not so new to keep them on the path of recovery.
So you share resources with patients and others looking for resources, and that RCP is a designation that identifies the person as a trusted and value in their field. So what do you do in a typical day?
I work with patients, families, and other professionals to get people to where they're a good fit. In other words, if somebody has no insurance or insurance through Medicaid or Medicare, I provide resources for them to get into treatment.
So according to what their needs are with geography or their insurance status and even the level of care you mentioned.
That's correct.
Would determine where somebody's going to go. And then you also do some pre-assessment?
I do pre-assessments with folks, yes, over the phone, mostly, but sometimes in person.
You also provide peer services for New Horizons. What are the typical supports that you provide as a peer?
So for New Horizons, when they get a call from one of the hospitals that there is an overdose or someone in need of treatment. If I'm on call, I'll go right to the hospital and right to the patient's room and talk to them about what they'd like to do, where they would like to go, what level of care they need, and then I help facilitate getting them to that place.
I know that when we talked to prepare for this, you mentioned that typically many are homeless, have no insurance, and that it's extremely difficult to find beds, and that sadly, you said that those sometimes are the most willing to actually receive help. So we want to make that known publicly that we need more beds in our community.
Oh, correct.
Right?
That's the largest, that's the biggest problem that I encounter when I go into the hospital and talk to someone that is looking to, get treatment, is that if they don't have insurance, there's barely any beds available. And that's a big problem.
We need to address that locally. Why did you decide to get involved in this type of work?
Well, actually, it happened by accident. I got into recovery back in 2002. So my anniversary is coming up this month.
Congratulations.
And thank you. And when I got sober up in Rochester, New York, and then when I came to Florida, I ended up working in the call center for the program that I'm working for now. And I started answering phones for people that are looking for help, families and folks that needed detox and recovery. And it just grew from there. So I've been working in this field since about 2012.
Well, I love featuring stories like that to give people hope and know that not only recovery is possible, but also it's a wonderful field to work in and be able to give back and support others who are ready to make changes. I know that you believe in leading by example, and so thank you. How do you make a positive impact in our community?
So I think by being involved with various grassroots operations, things that are advocacy oriented, getting involved with the task force, and really just putting myself out there as a resource is really the best way for me. My phone number is out there, and if someone needs help, they can call me, and I will make sure that they get to where they need to be.
I witness this every time I'm with you. I know that you get phone calls and text messages, and people are actually reaching out to you from all over the country as a personal resource. So thank you for that work. And what do you do personally to stay positive and maintain a balanced life yourself?
So I turn my phone off at 8 o'clock at night.
Okay. Smart.
I found balance. I do practice some spiritual practices, namely Native American spirituality, but I do a lot of meditation, and I spend time with family, and weekends are generally have calmed down a little bit for me. So,
and I know you have a new special person in your life.
I do have a new special person. I do. Yes. I'll be married on September 2nd.
Congratulations. Very exciting news. Do you have an impactful story about somebody you helped who has moved forward and found their purpose?
I do. So I went to a peer call at Indian River Hospital in Vero Beach, and I would like to give a shout out to Maggie, who is a case manager there.
Okay.
I happened to be there, and I met her, and she said, "Oh, while you're here, I have a guy in this room. Can you go see him?" And I went up to his room, and he was a chronic, drug user, and he had been in and out of the hospital for about the past year and a half, and he'd go to programs, and then he wouldn't be able to, stay sober, and he'd end up back out on the street again. Maggie had worked with him multiple times, and I went in and talked to him, and we were able to secure a halfway house for him at a transitional living facility called Nehemiah, which is also in Vero Beach. So they get a shout out as well. And the last time I spoke to them, which was about a week and a half ago, they reported he's still there. He's sober. He's working, and he just applied for another job, and it's expected that he's going to get it. So he's thriving.
Love those
and
stories.
It's wonderful. Yeah.
And what message of hope and encouragement would you like to leave our listeners with tonight?
Oh, the message of hope that recovery does work. Don't give up on yourself. Don't give up on your family member. Never give up on someone that is looking for recovery and wants to get sober, because as long as there's willingness, there's hope. And I'm here to spread that hope.
Thank you. I know that when we prepared for this talk, we also talked a bit about stigma. We know that stigma is the missing piece in our nation's response to the addiction crisis that that substance use disorder is not a moral failing. It's a treatable illness and a misunderstood medical condition. And we have to really work hard around reducing that stigma. It's somebody's fault or that they can fix it themselves. It's a medical condition. It's no different than diabetes or heart condition and deserves the same medical treatment. So thank you so much for joining me tonight and bringing all of the work that you do in the community to help make a difference.
Thank you, Eve. Appreciate it.
As you have heard, we're in an overdose epidemic versus an opioid epidemic. Buying drugs on the street is a game of Russian roulette, from Xanax to cocaine. Drugs or counterfeit pills purchased in non-medical settings may contain life-threatening amounts of fentanyl that can be 50 times more potent than heroin and 100 times more potent than morphine. Police administrators across the country are recognizing the need to connect individuals with whom they come in contact with in the community to evidence-based treatment to better address the large social and economic burden of substance use disorders that can be a chronic and relapsing condition. As gatekeepers of the criminal justice system, police personnel play a vital role in preventing and intervening in the cycle of offending and advancement through the criminal justice system. Police frequently encounter substance-using individuals and their families in the community and often have repeat contacts with individuals suffering from substance use disorder. Tonight, I'm privileged to have Commander Carmine Izzo of the Port St. Lucie Police Department join our discussion. Commander Izzo leads the Special Investigations Division that includes narcotics, gang, organized crime, and homeland security. Commander Izzo, I understand that the Port St. Lucie Police Department utilizes a proactive policing approach to reduce and eradicate all levels of drug activity in our community. Can you explain what that means and how this is accomplished?
Sure. First, I'd like to thank you for having me on this evening.
Oh, our pleasure.
Take the opportunity to get the word out. With policing, we use a variety of approaches when it comes to dealing with such a complex issue. It affects so many people in our community from all different socioeconomic statuses that we can't stick with just one approach. We have a variety. I'll start with the proactive approach. Our biggest proactive approach is to prevent these open-air drug markets from even becoming apparent in our community by focusing on the items in the community that lead to that type of degradation of a specific neighborhood. Blighted properties, vacant homes, where it seems like no one cares about this community anymore, and that gives opportunists a chance to move in and set up shop. So we try to be proactive and address all those characteristics that make a community more conducive to drug dealing. Port St. Lucie, with the design of the city, we don't have any of those areas specifically that suffered from years of neglect. We stay on that. We try to keep the community beautiful and make people care about where they live at. So that's a proactive approach. But one that's more common that we deal with, drug complaints is a reactive approach. The complaints, they come in, people, they live in those neighborhoods. They know what belongs, what doesn't, who belongs. So they bring these to our attention. And we often hear the see something, say something. The next phase of that is someone has to do something. And that's where we come in. If members of the community bring it to our attention, we have to take it seriously and go out and do an investigation and find out what's going on there.
So what is the best method for someone to say something if they do observe or are aware of activities in their neighborhood?
Well, we have a variety of ways to contact and bring those to our attention. The most common, obviously, is calling 911. But sometimes people don't want to do that. They don't see it as an emergency at the time, so they want to take a less emergency approach. In the City of PSL website, it's www.cityofpsl.com. There's a link there where you can submit your complaints. And with all these complaints, it can remain anonymous. I mean, a lot of times with drug complaints, people want to bring it forward, but don't necessarily want their name associated with it for fear of retaliation. We get that. We understand that. So you got that. And we also have a new app for smartphone devices. It's called 1PSL. You can go to the App Store and download 1PSL. And on there, it's a very convenient way to report any types of concerns in your neighborhood, be it drug complaints, utility complaints, overgrown bushes. So any type of service you would need from the city, you can pretty much reach it through that 1PSL app.
That's great. I didn't know about that. So I'm going to do that myself. What do you view as the most important day-to-day responsibilities of your team?
Day to day, the most important. It's interesting because when you think about someone living in the community, if something's happening in their neighborhood, to them that is the most important.
Yes.
So we try to understand that and be empathetic, take those complaints seriously and get on them. One of the obvious, most important things facing us now is the whole overdose epidemic, responding to overdose in the community. Anytime a parent has to lose a child or a child loses a parent, it's very, very heartbreaking. So these overdoses, trying to find the source of the narcotics that lead to the overdoses and hold them accountable.
You mentioned that law enforcement has changed a little bit over the past few years about a dealer being being arrested?
Yeah, there was a law change a few years back where an actual dealer who we can identify as being the supplier of the narcotics that led to the death, they can be arrested and charged with murder.
What are some of the effective strategies you employ to improve our goals to achieve drug-free neighborhoods?
Drug-free is definitely a goal we should all strive to achieve. Probably the best way to achieve that is have to have trust and collaboration with members of the community. They got to bring that intelligence to us, get that information to us so we can investigate it. No one knows your neighborhood better than you, so you know what's going on there, and you can identify things such as short stay traffic, suspicious people that shouldn't be there, and just taking the active role to go ahead and report that. Don't feel like you're being a nuisance by reporting something like that.
You recently requested funding for a dedicated position to respond and provide resource support for what we refer to as frequent flyers or people who have multiple incidents. How will that program operate?
Well, that's correct. Recently, we did submit for a federal grant for a drug diversion and intervention detective. So that would basically be a detective that is assigned to not so much try to investigate where the drugs come from, but to be that link for the families. There's a void there where we come in contact with maybe repeat overdose victims and the families, and they just don't feel like they have anywhere to turn. And we're lucky in this community. We have a lot of resources available to help people in crisis. And what we're looking for with this drug overdose intervention detective is being that person that can link those resources to the person in crisis and get them the help they need so they don't keep overdosing over and over. And we have evidence-based strategies at the police department where we try to track anyone that has series of more than one overdose, and it shows us that they are more in need of a high priority to get them the help they need, because if they keep overdosing, eventually and unfortunately they can have a bad outcome. We keep track of those that continually overdose and try to get them the help they need. And by having this position, it'll really put the accountability on that position to help get this done, to achieve it.
And I assume strong collaboration with Stephany, who we heard from earlier. Diversion's been proven effective in other communities, resulting in preventing criminal offending and improving the participants' health, as well as diminishing social costs associated with processing drug-related offenses. Can you talk about the harm reduction techniques used by your team and any recent statistics that demonstrate the positive use of first responders administering naloxone?
Yeah, naloxone has been a game changer. Early on, our chief and our administrative staff at the Port St. Lucie Police Department recognized the crucial need for it. So we saw the positive effects coming from having this out with our officers. We immediately deployed it throughout all the police officers on the street. We've had quite a few reversals where this Narcan has been used to save lives. I could just go back to this past year up to date from January 1st. We've used Narcan in about 65 incidents in the first 6 months of the year. That definitely saved some lives. So having it, not just with the police, but the fire department has it, and a lot of people in the community now carry it. And getting that Narcan to the person in crisis is crucial to save their lives.
As a task force, we're trying very hard to get it distributed in many, many places where the public frequent. It is a life-saving resource, and what the public really needs to know is if you administer Narcan, it won't ever hurt anybody, even if they're not overdosing. But it can save a life if somebody is. How long have you been on the police force?
It's like pretty much most of my adult life. I started in July of 1994, so 28 years. I came to Port St. Lucie after serving in the United States Air Force as a law enforcement specialist there. So I did 6 years in the Air Force, and then my last duty station was in North Dakota.
We appreciate that. Thank you for your service. I personally sense your dedication and compassion when I hear you present at community meetings. Is there any information or message you would like to share with the community?
Yeah, probably the most important to get out there is, I can't stress it enough, is when you're buying drugs on the street, you never know what you're getting. And right now, when we do drug seizures, we're seeing fentanyl in just about every drug out there. A person may think that they're buying a different type of drug, and it's loaded with fentanyl. And they don't intend to overdose, but they don't know what they're putting in their bodies, and before they know it, there they are overdosing. And we also hear that saying, one pill can kill. That's true. I mean, especially if there's fentanyl in it, it's just such a deadly substance, and it's so apparent out there in all these illegal narcotics that you got to beware. You don't know what you're getting.
Well, thank you for that message and for the work you do and the work your team does, the innovations that you're bringing to our community to really provide resources versus punitive measures. And we're grateful for that. When we spoke to prepare for this discussion, we talked about the fact that this crisis affects economic status, all races, genders, and ethnicities. If someone is listening and would like to access help for yourself, a friend, a coworker, or a family member, we mentioned earlier 211 is always available available. They're there 24/7. They don't provide the direct resources, but will connect you. You can dial 211 on the phone, or you can go to www.211.org. And I'm also always available to connect people in the community. My email is elyon@careersourcerc.com. That's ELYON@careersourcerc.com. Employment provides important structure as well as meaningful purpose for all people. For people in recovery, employment supports long-term recovery associated with better quality of life, greater self-esteem, and happiness. Please remember that 3 out of 4 people who experience substance use disorder will recover. And please consider CareerSource Research Coast to access resources for both job seekers and employers. A huge thank you to my guests, and thank you for listening. You could tune in next month at 7:30 p.m. on August 22nd to hear more stories about how recovery works. And also, I've been asked to share a resource for Treasure Coast Area Narcotics Anonymous. They can be reached at 772-232-8676 or treasurecoastna.com. They have lots of fun events coming up. Bowling, a dance, trivia game nights, potluck dinners, a great place to have a pro-social experience with your peers in a safe environment. So thank you, and I look forward to talking with you next month.